I'm really excited to see Startup Mission, which is a startup supporting engine of the state, working with the Ministry of Health and organizing such a program, which is very significant stride when it comes to promoting innovations, which is transforming the healthcare landscape. I represent the new program founded by UNAIDS and other UN system, including UNITAR and WHO, started in 2019, called UN Health Innovation Exchange, which is focused on coming up with a new approach which multinational organizations or donor-driven organizations like UN look at making a change by supporting mission-driven entrepreneurs. So if you look at in a traditional way of UN-operated systems, it's programmatic funding or project model of supporting programs when it comes to HIV programs, TB, malaria. Most of the time such kind of programs changes over the project duration. So we were experimenting from 2019 a program of finding out the needs from various ministries and countries where we operate, where our country offices are there, and work with the local entrepreneurial ecosystem and provide grants to them to make them to sustainability. So that's the vision behind setting up Health Innovation Exchange. Today the topic which has been given to me is to look at some of the technologies which is here to stay, which has come up during this pandemic, which could be used further for early detection, management of epidemics, stop it from going into pandemics. I've tried to make a cloud of few of the technologies which is interesting, which is here to stay. So if you look at one of the primary things, so the earlier speaker, Dr. Anil, mentioned about the significance and the way with which it is transforming the radiology services with AI. Likewise, multiple other technologies which is helping. Another one is blockchain technologies. We all discussed about the privacy concerns with sharing the data. So blockchain technologies are really promising, which is going to make a difference in keeping the privacy and compliance and sharing the information for peer references and development of new technologies. Open source technology is another one which really exciting. If you look at in historic timing, we were able to come out with the first sequence of COVID-19, and which was the major reason for, which was publicly available as an open source, which led to development of the vaccines, diagnostic systems in record time, which helped us to save a lot of lives. This applies to even open source software developments, to genomic sciences, every other places. Telehealth technologies, if you've seen the way with which practice have changed, healthcare has now moved beyond the four walls of the hospitals. The place where I used to practice before my current role is Narayana Health group of hospitals, where Dr. Shetty, our chairman, used to say the time when the hospital will be more of step-down ICUs and procedure rooms, and most of this management can be done remotely with the support of care providers, digitally with the family members. That's where we'll be able to make a big difference in healthcare. And also one of the key things which we should note here is one of the ticking bomb is hospital-acquired infections or AMR problems which you see. If you've got the shortest stay period with which we can get a patient discharged, it will make a big difference. So telehealth technologies with the new guidelines is really making waves. Companies like ADA in Germany can do diagnosis with much higher accuracy than our human analytics capability. We've also seen the technologies of 3D printing, which has made a big difference. There have been always, when the crisis was there, we had a Google sheet of set of things which is to be 3D printed and used, and that was crowdsourced facilities which are used for multiple essential medical products. So that's again going to shape the way with which the future is coming in. Few other things, being a geneticist, I get so excited about the possibilities of gene editing, CRISPR technologies, which we've been all hearing about, the way with which express diagnostics capabilities can be built in the short duration with such kind of technology is really going to make a big difference. Nanotechnology again, if you look at billions of arms are now injected with lipid nanoparticles, which is the delivery system for the Moderna mRNA vaccines. When we're talking about two of these technologies, which is really going to make a big difference in the next decade, I'm very excited to also point out the PREPARE program, which is done by the US military, which basically look at rapidly preempting, it's a preemptive expression of protective alleles and response elements, which is existing in our own body through some of the gene editing technologies by either overexpressing or masking some of our genes and give rapid response to protect most of the people who are exposed to this kind of infections, maybe in some of the compromised situations in the world. We have seen drones, the way with which it's been making the deliveries, the difference it's been making. I'm also been seeing Gen robotics here. I would say the time is not too far when Gen robotics, which is used for multiple scavenging purposes, could be attached with sensors to do real-time, infection surveillance and things like that. We also see great opportunity with synthetic biology, with which even the current problem of last mile delivery issue, where we need refrigeration for the vaccines, otherwise it becomes ineffective. But with synthetic biology, we could have a lot of new opportunities, which would be even thermostable as well. That was a bit of technologies which I thought I will bring up, but we all have access to enough of information. Google, we all see about the technology, but what's critically important is we have a lot of this new technologies which has come up over this. Looking at the brighter side of what we've gone through or what we're going through is there are a lot of technology shift. There is radical changes in the way with which we live, the way with which we approach things, which is coming here. But how do you see that this combined knowledge could be used for better managing epidemics? I particularly focus on the communicable disease, but non-communicable diseases equally. So with all these things here in place, we see half of the world still lack essential health services, and 100 million are pushed into extreme poverty annually due to health expenses. So if we don't put these technologies which we've got, facilities or human resources which we've brought into action during this pandemic for the fundamental healthcare services or a sustainable mode, the solutions of early detection or management or programs which you're trying to do with epidemics will not work. So the point I'm trying to make is we should have programs which is embedded into the regular health service or regular health delivery for the people, and all other preparedness, screening, surveillance should be integrated with those systems, otherwise it will not work. So from the Health Innovation Exchange national program which I run, we are developing a consultative document proposing some of the things which we believe, if we put together, can make a difference for preparing us better for the future outbreaks. So I thought I'll spend next few minutes about putting out this consultative framework, which is again in discussions. Take feedbacks or any of the supports later on which can be connected offline, and end my conversation. So we believe we should have a global health security program which should be set up in India, which is in connection with the global programs as well. So if you look at, we know that we are as strong as the weakest neighbors we have. So if you look at, Kerala has been doing extremely good in the early days of the outbreak, the way with which the healthcare system works here, the way with which public system and the private system work here, which is, it's a model globally. which has been even recognized and honored in the UN systems and globally as a case study. But if you look at, we are as strong as the weakest neighbor. So it's our duty and it's important for everyone to work with the other global systems and the best practices to be brought into other areas, so that tomorrow maybe another outbreak, which could be because of the global waste problem of spillages to infections coming out of the climate problems to several other kind of things which you're seeing, how do you kind of see that such a disaster is not coming again? So we thought fix these few problems through a global health security acceleration program with the national network would make a difference. So we focus on lack of private sector involvement. India, as you see, 70% of tertiary care is in the private segment, and we have got primary, secondary, which is in the public segment. When you look at the national ambitious mission of national health mission, universal health coverage, how do you kind of bring those things together? How do you make it interesting for private players to make it work together? How do you align the financial incentives to make it sustainable? So these are a few things if we can put as one priority there. Again, lack of public engagement from the community perspective. How do you get communities engaged to report some kind of unusual infections? How do you kind of get them to work together? That would be critical when it comes to any of the outbreak or detection management. Then ineffective utilization of facilities which you put forward. I'll just take the example of Ebola outbreak. There have been massive investments which has been done in Sierra Leone, many of the African regions during the Ebola outbreak. But after a year's time, the entire investments have gone rusted. It's not been used because these facilities could not be used for catering for the immediate healthcare needs there after the outbreak. So how do you kind of use the PCRs, the molecular diagnostic capabilities, which is put up right now with the pandemic, could be used for maybe looking at cervical cancer screening to any of the other head and neck cancer screening to any of the other priorities along with the other infectious diseases. So that would be critical. Absence of a global health security program working very closely with the local programs is going to be really critical. We have seen one of the first of the global pandemic and epidemic innovation hubs set up by WHO in Berlin. There's going to be some of such programs coming in multiple other parts of the world as well. So how do you do such kind of combination ecosystem is critical. Fast moving system with a new technology can be quickly brought into clinical practice is another challenge. How do you bring in policies? In the starting of COVID, we have seen even simple technologies were not going through the government health technology assessment from which it could be taken into use by the public. So how do you kind of create framework with fast health technology assessment and providing opportunities for startups to bring their products quickly into the market? A lack of a body to bring policies which assist the private sector in the same way would be critical. We also see a disparity, reverse or inverse pyramid kind of thing when it comes to the healthcare delivery. The higher side of urban setting, we've got all the tertiary cares, all kind of capacity built when it comes to faster surveillance to all kind of, but this outbreaks can happen in the low resource setting. So how do you kind of bring in point of care technologies to, how do you assist new technologies with which maybe lack of radiologists or pathologists can be covered by technology with which we can solve most of the cases? How do you kind of bring in such kind of framework would be critical. So by looking at these fundamental problems, we are proposing a national framework with which we develop a national public health surveillance system, where since we have startup mission here, we have health ministry here, if we create the ecosystem from the ministry side with the private players, and if we bring out a startup and innovation promoting framework by listing out the problem statement and guided innovation opportunity for the innovators, and get this both together, we can create a national public health surveillance system which is applicable nationwide. But being a leader in the healthcare programs, Kerala could take a starting dig at it is what we are thinking. The next is strengthening of national laboratory systems. So the vulnerabilities and difficulties in detecting, we have seen starting from the essential primers for molecular test, which was not possible to be sourced in India in the early days. So how do you kind of build capacities, point of care systems, framework around it is something which is the second thing. Again, creating ecosystem and problems which can be solved by the innovators or existing startups could make a difference there. Then about creating workforce, startups kind of working towards developing workforce. I heard in the last discussion about creating digital training programs for the healthcare workers, which is going to be very critical. So systems which will make it sustainable. It could be even creating drone system to kind of mobilize the reach of diagnostics, which is put up in remote locations on a hub and spoke model. To any such kind of sustainable models is going to be making a difference. The fourth is about setting up the public priorities. I see in India we have health as more of a state subject in combination with national. So look at state priorities. How do you kind of align people working with the state priorities to make it, getting maximum impact is something which again we can look at. It's again a working document. We are taking stakeholders' inputs and putting it forward globally. In India, we are starting the first EPIC hub, which is Epidemic and Pandemic Innovation Hub in Indore with IIT Indore. We're looking at some other geography also to start as an experiment. Also, we look at low-cost scalable solutions for preventing diagnostic therapy and recovery management. Getting into my last slides. We just see that if we can bring this framework where the ecosystem and innovations are brought together, create an acceleration program here. There we can take an innovation pipeline, mixing with local innovations are best suited for solving the local problems. The innovations which is coming from India is very relevant for any emerging countries, and like we are the global pharma, we could move into even diagnostics and other places as well if policies and the emerging startup spirit which we keep up and move that through a smooth framework of technology development, clinical validation, business mentorship, regulatory and IP. Still a struggle, still we are dependent on CE and FDA before getting into the scaling of our Indian innovations. That's one of the activities which we're working to do, global market shaping, by seeing how we can take Indian innovations accepted with a coalition of emerging economies or coalition of consumer nations where they are mostly dependent on developed economies. Then also providing scale-up funding opportunities for them. We see that a lot of early stage fundings are there with the government system, central government, BIRAC, DST, startup mission, state government supports, but do we have enough of scale-up funding? Most of the time we're dependent on outside entities to kind of support that. So how do we create that? That's another thing which we're looking at. So through this framework, if you put up innovations, it would make a difference. This is my last slide. So as a starting point for this, we have already created a COVID resilient innovation map, which is mapped almost 1,500 cities across the globe. Innovations which has come out of that, best could be, it's available online. Best could be used for scaling into whichever relevant geographies, and be better prepared for managing existing epidemics and stopping them from moving into pandemics. Thank you so much. It's a real pleasure to be here, and thank you once again Startup Mission and Ministry of Health for this opportunity.